Good evening and thank you for joining us. We begin tonight with the dire situation in Ontario. The province is consistently reporting more than 4,000 new cases of COVID-19 every day. And there are a record 2,100 people in hospital. Now, several provinces and territories are stepping up to help the doctors and nurses on the front lines. Our Ottawa correspondent Michael Couteur has been combing through the details. Mike?
Well, Robin, we were given details of this plan at a press conference late Sunday afternoon. The federal government will be sending healthcare workers and equipment to help Ontario as it continues to battle record-breaking COVID-19 case numbers. That help comes mainly in the form of nurses who work now at National Defence and Immigration Canada. They will be deployed to the Greater Toronto area in particular. Now, some of them will help with rapid testing, while others will go right to the front lines in hospitals.
Our government has offered to cover all of the costs and coordinate the movement of healthcare staff from other provinces to the front lines in Ontario, including using military aircraft to help deliver this help to Ontario.
With COVID-19 burning like a wildfire across parts of Ontario, the federal government has also asked other provinces and territories if they can spare healthcare workers to come help. Prime Minister Justin Trudeau says that he spoke to the premiers of the Atlantic provinces as well as the territories, seeing if they have any extra resources. Now, in a statement, a spokesperson for Ontario's Health Minister, Christine Elliott, told Global News they're grateful for the federal government's help, adding, quote, "We will continue to work with all levels of government and healthcare partners to protect the health and safety of Ontarians and combat this deadly virus." Now, all of the costs, as Minister LeBlanc just said, will be covered by the federal government. This particular pandemic spending won't be accounted for, though, tomorrow in the federal budget. But if you were looking for hints about what we might see in that budget, Federal Finance Minister Chrystia Freeland dropped a hint last week at the Liberal Policy Convention.
Maybe an epiphany, as you put it, on the importance of early learning and childcare.
Hi, Erin.
It's widely expected the Liberals will be laying the groundwork for a national childcare program. Freeland and economists have spoken about the importance of childcare in starting the she-covery of our economy. The impact of the pandemic has disproportionately affected women.
It's just like a road or a bridge. If you were to cut off 30% of the roads and bridges in your provinces, you think you can reopen and everything's fine? No, you're going to have to do something about that part of the infrastructure. Childcare is critical social infrastructure.
The government has said stimulus spending over the next 3 years will be between $70 and $100 billion as Canada emerges from the pandemic. The Parliamentary Budget Officer pegs last year's deficit at $363 billion, and next year's is estimated to be about one-third of that, at $121 billion. Economists say once you get beyond the sticker shock, you need to see if that spending is putting Canada's financial future in a better position.
As long as you can make those good investments, those targeted investments, that would boost Canada's economic capacity. And that's the tough part. So that's what the government will have to carefully consider as it prioritizes its spending plans.
Part of that could mean pivoting towards a low-carbon economy and other sectors of innovation.
Are we going to focus on innovation that includes green, but also software, artificial intelligence, biotech, resilience, those aspects?
So, will this budget lead to an election? Well, a new Ipsos poll done exclusively for Global News says 53% of Canadians don't feel it's necessary to go to the polls this year. And those people may get their wish. The NDP has already said it will not trigger an election during the pandemic. Robin?
Mike Couture in Ottawa. Thanks, Mike.